TriageLogic is designed with the goal of keeping up with current technology and evolving as the needs of the medical community evolve. We could see telephone medicine becoming the basis of changing the healthcare system, since it is the most cost-effective way to provide medicine when the physicians are not directly available. The studies have shown that every phone call made to a triage system will save somewhere around $42 to $44 per call, and it's the most cost-effective way to provide patient care when the offices are closed. Studies have also shown that if patients don't have access to a healthcare provider after hours, about 40% of them will end up in the emergency room. So what we see Triage is the future of changing the healthcare industry, and TriageLogic playing a leading role in helping that change and providing the support, services, and technology needed to make that happen.
TriageLogic uses only RN nurses. Our nurses are trained for at least 6 months before they're able to take phone calls from a patient by themselves. Our calls are fully documented and recorded. We use standardized protocols. We also have the best-in-class software. So not only do we have physicians overseeing the whole system to make sure we're having the best possible care, but in the back end, we also have best-in-class programmers working with the software, working with the system to make sure that there are no interruptions, and then the system is working seamlessly, so as the nurse is taking phone calls, that information is also being integrated with the electronic medical records of the office practice, so that the physicians taking care of the patients are also know what took place overnight. So there is no transition for the patients between seeing their doctor in the daytime and having our nurses take care of the patients at night, because we coordinate to make sure all the information is together for the doctors when they're seeing their patients during the daytime.
With the emergence of the concept of the medical home and the accountable care organizations, one of the most important components is to provide 24/7 access to their patients. This puts a large burden on the providers. And if the providers don't want to take phone calls, it puts an even larger burden for the system to develop their own nurse triage system. And one of the advantages of an outsourced triage system is that we can use our expertise and our technology to provide a turnkey solution for any organization, hospital, individual practice, or accountable care organization, to provide 24/7 customized, reliable nursing care, along with the high level of technology, including integration into EMRs, remote on-call scheduling, and any other needs that could arise in the future.